Okay.
Yeah.
Okay. Again, my name is Phyllis. I am the founder of Sacred Ibis Botanicals in Hudson, Wisconsin. I'm a master herbalist, but my specialty is women's hormonal health. So I help women suffering from conditions like endometriosis and fibroids to be pain-free, energized, and to feel like themselves again. And Dr. Krystle and I met at an event. It was International Women's Day, an
Yep.
International Women's Day event in whatever month that was now, April. That seems so
Oh, was
long
that the
ago,
one?
doesn't
I think March. March,
it?
was that the one
March,
in
yeah.
Hopkins?
March. Okay,
Yep.
thank you.
Oh, I was at that one.
I was
Oh,
Okay.
were
gonna
you?
say.
Oh,
Yeah.
well,
Mm-hmm.
wonderful. So today is the first part of the series, the three-part series of the Free Women's Virtual Health series. So that we're going to be talking about the Maiden. The other two events are on June 13th and June 20th. So you probably already know all of that. And with that, I guess I'll pass it off to Dr. Krystle to start with her information.
Perfect. Well, thank you. And I'm so excited to do this with you. I think it'll be a really good collaboration of a lot of good information. So I'm going to go ahead and share my screen. Oh,
Oh, yep,
yeah.
yep. I think I have to do,
Please. Yeah.
sorry,
No, that's okay.
there we go.
Okay, perfect. There we go. Okay. So we go on here and can everyone see it? Yeah.
Mm-hmm. Yep.
Okay, perfect. Okay. Well, thank you so much again for having me. I'm so excited to talk with everyone today. With our women's virtual series, this is starting off as the Maiden. And I just wanted to start by telling you guys a little bit about our practice. So we're Advanced Medical of Twin Cities. We have chiropractic, massage therapy, cupping, acupuncture, rehab, nutrition services, lactation services. I'm a chiropractor, but I'm also a acupuncturist, a dietitian, and a lactation consultant. So I specialize and love to work with families, whole families, but especially women and children. Our clinic as a whole, we have a lot of with multiple doctors. My dad started the practice, and then Dr. Billy. We have the capability of working with and specializing in a lot of different areas. So, but we can help people of all sorts of stages in their lives. And this is my opportunity to show you my children, because I always have to do that. I'm used to, I love getting the opportunity to get to know my patients, and this is my way of getting you guys to know me and my family. So that's my son in the middle, Charlie, and then I have Anila and Sophia on the left and right, and they are just my reason why I like to do everything. So but I like to start off with just letting everyone know that everyone is different. So as we give these presentations, first of all, I have new glasses and they're not totally fitting me correctly. So I'm sorry if I'm playing with them a lot. But everyone is different, and this presentation is more for educational purposes, but we really encourage you guys to work with you can work with one of us or another healthcare provider or specialist if you are trying to reach more detailed goals or have more questions. But please feel free to throw anything in the chat or to ask us any questions as we go through. We're happy to help you. And then people that are watching this at a later time, if you guys have questions too, my contact information will be at the end. I think Phyllis's will be as well. So if you guys have any other questions and want to get in touch with us personally, please do. All right. One of my big things, though, is always listen to your body and your intuition. As women, I think that we have a knack sometimes for having our body just tell us what it needs or what's going on. And sometimes we just need to listen. So pay attention and trust yourself. All right. Our goals for today. Females facing unique challenges and obstacles that can be difficult to overcome on our own. So we want to help give you guys some tools to help you reach the different stages. Now, if you are past the maiden stage, a lot of this will also lead into giving you a little bit more discovery of why maybe certain things have been a certain way for you throughout your life. So I encourage you to apply some of the information, even if you're not in this stage. But this one obviously is focusing on the maiden, which is the young woman. So prior to motherhood, and probably we include that prepubescent, pubescent stages as well. And the first thing I want to teach you guys or work with is how the body structure can actually modify our hormone balance. So females in particular have a lot of hormonal changes that happen in the maiden stage. And so we're going to talk a little bit about how our posture actually can modify some of that. And then movement, how that will influence the brain and hormonal functions and development. And then what we can do to help our body. So some tips and ideas of things that we can do after. So what causes negative changes to young body structure? And this has changed so much over the last, I'm just going to take my glasses off because they're going to drive me nuts. But this has changed so much over the last 15, 20 years as electronics have come across. But I want you guys to take a second and think, when you think of the youth of today, what do you think about with their body structure? What might affect it? What this little girl is doing might be one thing that definitely affects it. She actually does not have the worst posture with this. Most of the time, kids are just looking straight down at their phone. Their hands are at their lap. So this one's not the worst case scenario, but we certainly have poor posture that can affect these young body structures. And that is cross-generational, right? So no matter what age you are, you probably sat in a classroom at some point, and you probably slouched and did stuff at some point in your life. So that's something that kind of goes all the way through. Torticollis also is something cross-generational. So that might be back, 15, 20 years ago or more. That might have been because we were holding our phone with our shoulder and doing this a lot. And so then we kind of get this little shift where every time you look at someone, they're always kind of tipping their head one way. It might not be that they were born with torticollis, which is the time that we normally think of it. Video games, electronics, that is the thing today, right? So I can't tell you how many times I have had my patients coming in, and the main thing that has to happen and change is we got to get things up so that they're using proper posture while they're doing things, or changing their positions while they're on their electronics or video games. Injuries, of course, can change our body structure. So if you're in a car accident, if you fell off your bike, if you tripped and fell down the stairs, but even little injuries, like micro injuries. So maybe you're repetitively doing something. I had one little girl one time that she loved making bracelets, and which is wonderful. That's a great thing to do, right? Friendship bracelets and things. She made me one too. But if you're always looking down and doing this, how can we modify that to improve our posture? Sleep positions also can affect it. I know younger generations in particular will wake up maybe with the head on one side of the bed, and then they go to sleep with it on one side and wake up with it on the other because they're moving and shifting so much. So sleep positions, lack of activity, and so much more can negatively affect our young body structures and older. So hormones and body position, this is one of the areas that I don't think people are as aware of. There was a 2010 study at Harvard it was a woman named Amy Cuddy. And basically what she found is that having a proper posture can increase primarily change two hormonal structures. So first of all, it can increase testosterone levels by up to 25%. And it can decrease cortisol levels by up to 20% compared to just slouching. So most of our kids, when they're sitting in school and everything, are slouching a large majority of the time. And just in general, right? You see someone is sitting on a bus or waiting in line somewhere. It's not very common to see really good posture. And this study proved that it can affect our hormone production. Now, you might be wondering, why does testosterone levels matter to a female? Because testosterone is typically looked at as a hormone for like a male hormone. But a young woman in particular, we need it for different reasons throughout different stages of our life. But these are the main things that come into play for a young woman in particular. It's going to support reproductive health at all stages of life. So we do need a proper level of testosterone, not a high level, but a proper level. That's going to help contribute, though, in this stage to sexual maturation of the tissues and the brain. So think about you're heading into puberty, or have just gone through puberty, or you're in those first few years of having your cycle. If you don't have everything maturing, the hormones to help things mature the way that it needs to, tissue repair and development, all of those things happening at the same time, you could be affecting yourself long term. So I know it says on the bottom, but low levels during this time can affect the structure of the hormone, or of the female reproductive tract. And so it can affect and lead to some infertility things later on. So that's one of those hormones we want to look at right away too, because that development time period is so important, right? Bone density. You need testosterone in order to create proper bone density and muscle mass. So if we're not getting that, our primary time of developing bone density happens by the time we're females. It's usually around early 20s, where we're going to stop producing or getting increased bone density. So what you have for bone density for the rest of your life is happening in these first years. So it's really important that we're supporting that. The same with muscle mass. Muscle mass we can get later on too, but that bone density is really important. And then those teenage years, I know I was particularly moody at times. And this actually can help with your mood and energy levels. So it's a very good thing. Even just something as simple as improving our posture can actually improve our mood. And that can go cross-generational. All right, so cortisol levels. Cortisol is the stress hormone. So that you'll hear a lot of times from people, that it can affect our bodies in so many ways. High cortisol levels can lead to even some disease processes later in life. So we're really important, especially in these very special years of development, to keep those as low as possible, as low of stress levels as we can. So improve posture, improves your cortisol levels, which then decreases stress, and it makes it a much easier transition into womanhood. All right, movement. This is one of my favorite things to talk about with people. Being a chiropractor, I want you to move, right? Movement is life. So we want to have that as we're working through with anything that we're doing in our stages in our life. But this study, I think, is really interesting, because I think that there has been so many pushes over the last 20 years to try and improve physical movement with our youth, knowing that that then can lead to, especially in the US, where we have a higher adolescent obesity rate and everything. But there's so many pushes to try and increase movement. And this study from the World Health Organization, WHO is World Health Organization, from 2019. So my assumption, they haven't released another one, but my assumption would be that it's worse. COVID, I don't think, helped us move more, at least in the adolescents. They got even more secluded and everything. So I'm guessing this is worse, but I don't know. But what they found is a gradual increase in movement over the 10 years prior for boys, and zero increase in movement, if not actually a decrease in movement, for women and girls. And this study was on ages 11 to 17 during that time period. So what they found is, in the US, more than 80% of girls were not meeting their physical movement needs each day. So that is a huge number of kids, specifically females, compared to, I think it was in the high 60%, if I remember correctly, for boys. So still not good for boys either. But during this time frame, women mature quicker and we go through puberty and things quicker than boys do. And so us not moving, why does that matter in sense of brain and reproductive health? The main thing is that if we're not moving, we're not increasing our blood flow, we're not getting good oxygen flow. And if the organs and tissues are not getting good oxygen, they're not developing as well as they should. So if you as a in the motherhood or golden years stage are looking at, oh, when I look back at my youth, I wasn't getting maybe an hour of physical activity a day, that could actually give you a little bit of an idea of why some of the things didn't develop all the way as well. So it is something that we can work on and improve, and it's never too late to move more. But it's definitely an area that affects our adolescence. So as much as we can encourage, I never want to force anyone in this maiden stage or anyone ever. You don't want to force someone to move, right? Gym class is great. I love gym class, but that's really the only time that someone should be telling you exactly how to move, where to move, when to move, right? Other times, what we want to be looking for is encouraging movement. And one of the best ways to do that is, if you're a parent, is to create a good, be a role model and create that good example, do things together with that child. And if you're in early 20s, I always say, make your tribe, find your tribe, right? Of people that want to move and do things together. And that is basically for the rest of life. So find those people that don't want to just, watch TV and eat chips. You want to find those doing that sometimes is wonderful. You can always do that, but we want to find those people that want to do something with us that we also think is exciting. That balloon is creeping back over. I see it. All right. So nerves, muscles, and spine. Oh my. This area I like to talk about, again, because of my background. I want people to understand how that works and how that can connect to hormonal production, and how it's most common in this maiden stage to have a lot of troubles with getting your period and your cycle to regulate, and also to have it be comfortable, which we should have. Our cycles should not be something that puts us in this state of not being able to do the things we want to do. And so if you think about your brain, then you have your spinal cord, nerves that go out to every part of your body, including your uterus, including your eyes, including everything, right? If that highway of messaging is not getting all of the information, if there's like a roadblock or a jam on there, a kink in your hose, if you're squirting water, that information is not passing back and forth to the brain and the organ, it can cause a lot of these problems that happen with trouble cycles and periods. So there's also points that we can push with acupressure, acupuncture, and different areas we can push to help release different hormone production and help make those things feel better and work better with massage too. So it's just really important, increase that blood flow, increase the nerves to work the way that they're supposed to, and increase that messaging, and that can help with that cycle. All right, I will pause this really quick. We're gonna do a quick little video together, but the main thing here is, what can you do? So big thing is, at as early of an age as possible, is encouraging proper posture. If I could rid the world of W sitting, I would. If you don't know what that is, it's when a little kid sits with their feet out past their butt and it kind of looks like a W. That's a whole nother topic, but don't do that. Encourage your kids not to do that. And then we've got posture while we're doing things. So work on, how do we get those elbows up so that whatever electronic we're doing is up in front of us, or change positions, lay on your stomach for a while as you're playing your video games. There are a lot of different things we can get that actually will hold the things up in front of our faces so we can see. So there's a lot of devices and things. We can talk about that with you. We want to work our core and connecting the different sides of the brain. that exercise I'm going to give you. This one is the one that I target towards youth, basically 20 and under. We want to encourage movement. We talked about that. And again, really encouraging that movement, doing it together, trying to make it a fun activity. It doesn't need excessive, also has its own problems, right? But that good amount of movement, targeting for around, in this stage, especially around an hour a day worth. It doesn't need to be consecutive. Ideal if it is, it doesn't have to be. Posture exercises. So this top one where you see the woman doing the 2 positions. So this one I just want to talk through really quickly. We're going to take our thumbs and reach them towards the back wall. So if you guys want to do this together, we're sitting up, feet flat on the ground, reaching those back. So we get a nice stretch through here, and then we're doing a double chin. So give yourself a double chin. Take a deep breath in and breathe all the way out and let everything just fall and relax. And that's getting our body into what's called anatomical position, which is just the way our body is meant to be, getting the most oxygen and blood flow to the rest of the body. So it's called Brugger's relief position. If you want to look it up, it's a great posture exercise. And then I'm just going to play this. This is one of my favorite exercises for youth. You can see this. All right, so that just gives you a really great way to connect both sides of the brain and really get the body functioning as good as it can in a movement style pattern. All right, and then anyone that has any interest, my last thing here is just that if you'd like a free checkup with me or a care plan, either in person or virtual, I would love to do that with you, help you get a little bit more detail and information about what our things can do. Even if you're not local, I can help you as much as I can. So that is that information. And if anyone has any other questions, please send them over to us or let us know on here. So thank you.
Excellent. Thank you, Dr. Krystle. Judy, do you have any questions?
No, it was very informative. You guys, great job. But there's some, some ahas there for me.
Good.
Like my personal menstrual cycle journey was very, very difficult.
Yeah.
So it was just interesting. You I can connect the dots, right, of what's happening to me now. And so,
excellent.
No, thank you.
Good. Excellent. Yes, thank you, Dr. Krystle. Just due to the time, I'm going to quick get into my slides. So again, talking about the Maiden. So in my practice, oh dear, oh, here we go. One of the things that I see often, so the structural components, right, help, as Dr. Krystle said, bring blood flow and all of that, right? And another thing that's super important is your nutrition. So nutrition has obviously what you eat, but then there's also like what your body is able to absorb. And if you have other deficiencies, then you're not able to take in other nutrients. They're all kind of interconnected in how your body absorbs them. So in this list, these are the common nutritional deficiencies for young girls, menstruating and not menstruating. So that's important. Just that iron piece is that key difference there between menstruating and non-menstruating. But the 3 nutrients that I see deficiencies most common in my practice and are also a huge issue where we live regionally at the 45th parallel are vitamin D. Vitamin D for many reasons. That's because when we go outside, we wear sunscreen, we don't go outside. And then also some gut health issues. But vitamin D is super important for every system in your body. When you think about how humans live, right? The sun regulates our days. It regulates how we spend our days. It regulates our seasons and everything. It's the same inside your body. So vitamin D regulates all of your major systems in your body, and you have to make sure you're getting enough of it. Otherwise, your hormone health, your immune health, your mental health, everything will suffer. And I think I had read it's up to 30% of the population of the US is considered deficient. Now, deficient is very deficient. That is like very, very low. But when you look at even just having low vitamin D, which is what most of my clients who've come into my office have, it still is enough that your body systems aren't functioning properly. So then you can run into things where you then may have low iodine. So iodine is another regionally deficient nutrient because iodine comes from the ocean, and we are definitely not anywhere near an ocean. We are landlocked. Most of our soils are depleted. The iodine has been depleted from our farming practices. Or if we're getting our food from somewhere else around the world, we have no idea what the iodine content of that food is. Iodine, again, very, very important for thyroid health. Thyroid helps, regulate hormones and everything else. Then third most common nutrient that I see deficiencies in is selenium. So selenium, again, is another ocean nutrient, comes from the ocean. So the foods that you want to eat, like seafoods, those kinds of things, selenium, again, is tied to that thyroid, right? So if your thyroid is suffering, then your hormones, your reproductive hormones are also going to suffer. Other nutrients, calcium, B12, protein, zinc, and then iron. So iron especially for young women who just start menstruating is really, really important. You need iron for all of the systems in your body, obviously, but especially for the young women who start out with very heavy periods, iron is super, super important for them because you just get into that cycle of heavy bleeding and then anemia, and then it just keeps kind of snowballing as the years go on. And that's a cycle that I've been through. So I definitely know that cycle. So and then was put on birth control, and that's like a whole nother it's a whole nother topic that we could go into. But what is a normal menstruation? So the American Committee of Obstetricians and Gynecologists has determined the menstrual cycle to be the 5th vital sign for teenage girls. And I would love to argue that I feel that the menstrual cycle should be the 5th vital sign for all women who are in that stage. Just because it does give you so much information that's so important. And it's another aspect, I feel, of women not being heard and not being listened to. So if the menstrual cycle, if doctors listen to the problems that we have with our menstrual cycle and maybe knew how to support us in a lot of different ways, or if they didn't, could send us to someone like Dr. Krystle or myself that could help them, it would be fantastic. But that's my soapbox on that. The normal start of menses can be ages 10 to 16. The average here in the United States is 12. I was shocked to learn that the average in Russia is 16. So I am like so curious now to understand what is the difference of 4 years. So that is something that I'm going to be researching on the side. The normal length of a period should be between 3 and 5 days and occurring anywhere from 23 to 35 days. Normal blood flow. So this is something that I never knew until I started this profession. But the normal blood flow for one menstrual cycle is between 5 and 80 mils. So that's really hard to understand, right? Because how do you know how much blood you're bleeding, or you bleed unless you maybe have a cup and you know what your cup holds. But a regular absorbency tampon holds about 3 mils. It looks like so much more than it is. Like if you were to see that in a pipette, it doesn't really look like that much. But one super tampon holds 12 mils. A regular pad holds about 5 mils, and a super saturated overnight pad would hold about 15 mils. So the menstrual cycle will then obviously be a combination of light and heavy absorbency overnight and daytime, but that whole time frame should not be more than 80 mils. Repeatedly soaking through a tampon or pad every 2 hours is considered heavy menstrual bleeding, and that's the type of bleeding that will lead to anemia. And then you want to encourage your maiden to track her cycles. So this is something my niece just started cycling, and I was encouraging her to get one of the apps, because that's what the kids do these days, is get the menstrual cycle apps, or at least to be writing them down, to be writing the length, to be writing any symptoms, any pain, any discomfort, anything else that comes along with headaches, any sort of things, and even mid-cycle. So mid-cycle issues are huge keys as to where your hormones are at and which hormones are out of balance. And then also recommending a well woman check at the start of menstruation, just to have that baseline and to make sure that going forward that we know where we're starting from. What's abnormal? So painful breasts or pelvic pain during ovulation. Again, that mid-cycle gives you lots of information as to which hormones are out of sync. More than one period in a 35-day span. So if you're having more than one period in a 35-day span, that means that you're not actually ovulating, so you're not actually having a full cycle. So that's a huge issue. That's potentially PCOS or other hormone-related issues. Periods that last more than 7 days. So that's usually an indicator of some sort of reproductive disease or issue like endometriosis or fibroids. Intense pain or cramps during menstruation, especially a downward pull or pain radiating down the legs. Again, indicators of things like fibroids and endometriosis. Any kind of PMS during the month. So there are several different kinds of PMS. There can be kind of more of a depression, there can be the bloating, different kinds. But anyway, if it's to a point where you have to be taking large amounts of medication, I mean, I would expect there to be some fluctuations right before your period because your hormones drop drastically within a 24 to 48-hour period. So some minor like cramping or discomfort, like I can definitely tell, like there's just a feeling, I don't know, after a while, you just know. But if it's anything more than that, then that's usually a sign that something's off, whether it's a nutritional deficiency or something else. And then acne, especially cystic acne around the mouth and around the chin, any sort of facial hair growth. Then we're kind of into that PCOS realm, potentially as an issue. So how to support our maidens. So nutrition is important, as I've already talked about those nutritional deficiencies, but really working on those high antioxidant foods, especially leafy greens, brightly colored fruits and vegetables, berries, seeds, and nuts. I love to recommend for my clients herbal infusions. So these are infusions that are intended with water to remove nutrients and micro and macronutrients from the herbs. So the two that most common I recommend are nettle and oat straw infusions. They're high in all the B vitamins, macronutrients like protein, fiber, and then also nettle is very energizing. So it's a great herb to use in the spring. And then I love oat straw. It's a nervine. So that's a great one for teens who are experiencing anxiety and maybe mild depression. It just kind of helps build energy, but not like I think of nettle as the Red Bull of the herbal world. It just provides so much energy. It's just energy packed, whereas oat straw is like a good like internal energy and in out versus nettle, which is kind of all over the place. Like if I had to draw the aura of nettle, it would just literally be like all over, where oat straw would just kind of be like a channel of light going straight up to the heavens, kind of, you know. And then other supportive foods, I really, really recommend for the iodine and selenium, kelp flakes. I think that it's so easy to add to your food, making sure your salt is iodinized. And I think I had something else I wanted to say in there, but I'm forgetting, so I'm going to move on. For cramps, so it just happens. We have them at some point in time. Ginger, so a ginger compress, you can actually just take fresh ginger, powdered ginger, whatever, mix it with a little bit of water. So for the fresh ginger, you'll pour hot water over the top, let it sit until it's cool. So I would say if you take like a tablespoon chunk of the ginger, pour over about a tablespoon of water, you can then take that and soak that into a rag and put that right on your abdomen where it hurts. And that ginger will soak through and then can help relieve cramps. Drinking ginger tea is another way to work with that. Motherwort, only if you have normal bleeding. If you're bleeding more than 80 mils per menstrual cycle, you do not want to take motherwort because it is an emmenagogue and it will continue the bleed. It'll make you bleed more. And then, but otherwise, that does really help stifle the cramps. I don't know how to explain the mechanism of that, but it does. You can just feel it, and it's really good if you have menstrual headaches with the cramping. Red raspberry leaf is something I recommend to all women to be drinking. It helps tone the uterus so that it's kind of astringent. So it helps pull excess moisture out of smooth muscle tissue, and in this case, especially the uterus, which just kind of helps tone it up. Great for prolapse, just great for uterine health in general. And then chamomile. Chamomile is an excellent herb for removing excess estrogen from the blood system. And it can even be xenoestrogen, so estrogens that aren't made from the body. It can help just pull out all of those excess estrogens. And then also it's great for cramps. So it just is a nerve, it's a nervine in that it's a relaxing nervine. So it helps relax muscle tissues and just kind of bring calm to the system. For mild to moderate anxiety, plants like linden. I don't know if any of you know basswood or tilia. It's a local plant here, a native plant here. We also have a European variety that is about to bloom. So this is a great plant for helping reduce anxiety. It's specifically recommended for ADHD in children, and it just kind of has an affinity for children in general. So part of my training is kind of plants have personalities and they like certain types of people. Or they're indicated for specific types of people. So linden is definitely for children. Lemon balm. So lemon balm is in the mint family. It's this great plant. I love lemon balm because it's a hypotensive. So it's kind of that relaxing nervine, again, that helps calm the nervous system, but also has a lot of other great, it's a hypotensive too. So if you have higher blood pressure, this is an herb for you. Again, chamomile. Because of that relaxing nervine. Same with lavender, actually, and then oat straw. So these are all relaxing nervines. And then oat straw as an infusion, definitely as an infusion. You can take it just as a tea where you brew it for 5 to 7 minutes. But I definitely think the infusion that you steep overnight is much more indicated. Flower essences. So flower essences are subtle plant energy that is used by taking the plant at its peak of flowering, and you imprint that water or imprint that plant energy into the water, and then you can take it. It's kind of far out there for a lot of people, but I've had great success with flower essences. What's wonderful is that they're not contraindicated with any medication. So this is a vibrational energy. It's not a physiological pharmaceutical remedy. And then I love to pair them with affirmations. And I think that's so important for our young women of today, is to be able to talk to themselves in a gentle way, to be able to tell themselves whether it's they need to be safe, that they have value, whatever it is that they need to hear. I just feel that the flower essence paired with those is just a great way multiple times a day, right, to get that message into their brain. So it's counteracting all the other messages they're getting all day long, and so that they stay true to themselves. So when you see things like skin eruptions, which again, right, is something that we often see with our maidens coming into womanhood. Skin eruptions are usually a sign that the liver is struggling. So we're going to work with plants that are a little more bitter. So working with dandelion root, burdock root, yellow dock. Plantain oil can be used on the outside, or on the outside, on the skin, to help pull those eruptions out and to help the skin heal faster. And then again, chamomile. So chamomile is just a great support for our maidens in general. So that's the information that I have for you today. This is how you can connect with me. I do offer a free 30-minute healthy hormone strategy session, is what I call it, but I can talk to anyone about anything. That's the link that you would use for my free session. And there's a little more information about me there. So does anyone have any questions for me? Oh, I don't know why it's doing that now. Oh, I hear you. I hear someone.
I can unmute. How
There we
much?
go. Now
Go
go ahead.
I have a question about vitamin D. How much should you be having?
Right.
For
So
vitamin D.
yeah, that's a really good question. So now the recommended daily allowance by the US is different than I would recommend.
Right,
So
right.
I worked for a medical testing company called Diasorin in Stillwater, Wisconsin here, and they were the driving force behind developing a vitamin D kit, and we were all their controls. So I can tell you from my 8 years of working with them that the US the RDA has changed from 400 to 800 international units, which is good. But for adults, and especially like adults, basically 20 and up, I recommend 4,000 units a day
1,000.
all
Okay.
year. It doesn't matter what your sun exposure is, because as soon as fall comes and that sun goes
Right.
below the horizon, if you will, because we can't make vitamin D here from part of September through March, maybe even into April. I forget what the exact dates are. So that whole time your vitamin D levels are dropping. So if they're a little higher when you get to September, fantastic, because all year they're going to start to drop unless you're supplementing. And there are foods that have vitamin D, again, like those animal proteins, right? Some mushrooms that have been exposed to UV light convert the D2 to D3 and then can provide vitamin D that way, but it's kind of a guessing game, and I feel like it's not worth playing that game when there is supplementation out there. So that's I would recommend 4,000 IUs daily.
Okay.
I agree. That's what, I usually do 4 to 5 is most of what
Most of the women I deal with are 4,000, and men I'll go up to 5,000. It depends on the weight. So
I found I find 5 them in 5,000. So that's what I've been taking.
Yeah. Yep. That's okay.
I had one other question for you, was just if you have, let's say, some of the teenagers that are picky and different things, do you have certain ways or things that you work with them? Are there, I don't know that much about it. Can they be mixed with foods or things, like if they won't drink a tea or different things like that?
Good. That's a very good question. Thank you.
Okay.
So having children myself, so when they were younger and I first was starting on this journey, right, I could get them to take anything, but after a while they caught on and we're just like, we're not doing this anymore. So for one thing, for the teas, you can add honey. So if or maple syrup, whatever your children like. Another thing that I kind of reverted to for the younger kids, as long as it depends upon what you think about honey in kids. So some people say 1, some people say 2, but I infuse honeys. And then that is a way to get the herbs, especially herbs like linden or lemon balm. That's a good way to get them those herbs. The chamomile, I feel, is you just have to do the tea. That one's kind of a tough one to get into anything else. It is it doesn't have a very strong taste. So like when I was talking about the skin eruptions and those very bitter herbs, those are the ones that I have a hard time getting my children to take. But one thing you can do is dilute them a little bit and then have them hold them under their tongue. Because it only takes, I think it's less than a minute for things to be absorbed from your tongue and show up in your bloodstream. The bitter herbs you have to taste on the tongue. Your bitter receptors are on your tongue. What happens is when those bitter receptors are activated, they signal to the pancreas to release bile and other digestive enzymes. So, or to the gallbladder, to the pancreas, there are different organs of the body, but those have to be on the tongue. So for my kids, will take tinctures, dilute them down, and just ask them to hold them under their tongue. And so it might be, so if it's say 10 drops of dandelion root, I'll at least double that and then make sure they hold it under their tongue. And that is better. And then we follow it with whatever chaser they need. So if it's lemonade, whatever it takes to get it down is what we do. But yeah, you're right. And sometimes if you can mix the plants in with food, for sure, especially if you're going to try working with powdered herbs. Another thing too is if you're going to use tinctures with children, you can just put it on their forearm, as long as it's not the bitter herbs. If it's not for digestion, if it's for like a fever, like elderflower, you can just put it right on their arm. And it's not enough alcohol, in my view, that the child isn't going to get drunk or anything like that. I don't think it'll affect anything. But that is another thing that I do, is put the tincture on the arm or the leg or whatever, just as long as it's on the skin, because the skin, it'll be absorbed into the body fairly quickly. So, but the tongue is the fastest underneath the tongue.
And you do a lot of these like blends and stuff. You have access and stuff too,
I
right?
formulate everything specifically for my clients. I don't sell singles and stuff just because I feel like I need to know more of what a person is taking. So many people are taking pharmaceuticals, and that's not a bad thing. It's just I don't want to get in trouble with contraindications and bad things happening from people who don't maybe know what it is they're on, or don't know, how something else might interact with it or whatever. So
wonderful.
That's what I do. Yeah. I hand tailor everything for my clients. Yep.
Wow.
Yeah.
You guys are just so wise.
Thank you.
Lots of good information.
Thank you.
Good.
Thank you very much. Okay, I'm going to stop the recording if that's okay.
Yeah.
Thank you, everyone. Let me see. I gotta figure out how I do that.